So why don't you come here? I want to have you do some lotion. I want to have you do some strokes that we just went through, and I want to get just a sort of a feeling of how that feels to you and how it looks to me. So then we go into touch after that. So that's good. So that's Wayne. Wayne did not needed to cup his hands because it's already lotioned. And you can see his broad fingers going up. That gives a fairly good contact to the body. Now I do see a little hesitation in his hands. It's a little bit tense still. And that's okay because he's getting used to the body and he's learning about the body. And of course I've just been talking about it, so he's trying to do everything that I said. Let's do that one more time. Just come straight up. Good. How'd that feel, Rob, if you compare it?
He's gotten a lot better. He's got really good steady motion.
Okay. And how do you feel the connection to the hands to the body?
He's got good contact, good steady contact.
Good. How does it feel to you, Wayne?
To me, it actually feels definitely down here. Checking it down here, this definitely, you like you said, has some movement here. And it does seem like he has loosened up a bit up here, but not as much. However, up there, we also know that there is some tension as well.
You feel that?
As I go through.
Running right into it, right?
Yeah, it's like a wall, like right here.
Right.
And you can even kind of see it on the skin where it starts becoming a little red.
Right. You can see the redness once we sort of irritated in some ways a little bit is staying longer in the area that is contracted more or more tense. So what I want you to do now is I want you to come down to the pelvis. I want you to close your eyes for a second. I want to take a deep breath. And then I want you to do the whole thing again with your eyes closed and focus fully on making contact with that body. So you try to expand your consciousness out of your hands into his body. And you feel, just tune into yourself and him. Into the broad stroke.
You could definitely sense that the outside of the body is not as tense as it is along the spine as you come up. So like here is pretty much loose and it's actually receiving the stroke more to like it's like right there. And then you feel like like a wall or just a little resistance. But definitely has loosened up a bit from doing the broad stroke. Definitely feel outside of the scapula there as well.
Feel that? Good. Alright.
And the ribs here, and then just kind of.
How does it stay right here? Don't move your leg, nothing. Just stay right there. How does it feel as your connection? Do you feel like you got a little bit more information from him when you take the moment to tune into yourself first?
Yes.
Yeah. I mean, there's not, you can't see that much from the fingers difference, but I can definitely pick up an energy that is like you're penetrating deeper.
Yeah.
After you check in with yourself and really focus, which means you're grounding yourself. Some people go and feel their feet, that helps them.
Yeah.
But then it helps you because you're in charge of this back right now. So you got to carry it. Emotion. You got to give the feeling of. You got to give a motherly feeling to it. How did you feel a difference between the after the check-in and the before, Rob?
Yeah.
How did it feel to you differently as a patient?
It's controlled a lot better as far as maintaining pressure steadily throughout.
Mm-hmm.
A lot more confidence in his hands.
Mm-hmm. Good. So that's an exercise that can be done easily, that I do when I check in. I often actually work with my eyes closed, which is very good. An exercise to increase the sensation of muscle more, which we'll go into next, or tension, or tense muscles, is if you take a rice corn and you put it in a phone book underneath some pages. Pages in a phone book are very thin. And so you feel the rice corn, and then what you do is you put more pages on top of it, and feel the rice corn again, you put more pages on top of it, feel it again, until you can't feel it anymore. You put the phone book aside, pick it up next day where you left off, and see if you can feel more of it. And that is a sort of an exercise to tune in to your sensibility and sensitivity in your hands, and you can develop more sensitivity. Of course, the best is working on people, but also some of these exercises are good to just, do once in a while to get more tactile experience with it. Okay? So when we now go deeper, we've done a broad, sort of an effleurage approach that when we look at Swedish massage, we call this effleurage, a broad stroke. Then we go into more of a specific approach once we've applied the lotion, once we get an understanding of what the tension patterns look like. And what I often do is, when I look at the smaller strokes, I want to cover a few areas in this back, generally speaking. Of course, if the patient comes in and he says, oh, I'm really tied up here, well, that's the main area I'm going to check and work on. But if it's